Probably. Thank you, Gina, for doing that. I'm assuming that was you. All right. Just know that if you do ask a question, I believe that is recorded, but if you put it in the chat, it's not recorded. All right. Hi. Oh, God, how much time do we just lose? All right. So apologies again. We are going to go through the COVID case rates like we usually do, go through top questions that we're getting currently around COVID. I want to show you some new materials from public health. And then if people want to talk about monkeypox again, we can talk about monkeypox again for sure. I brought that and I've updated it. And then, or if you want to talk about how to discuss monkeypox in community and talking points, we could do that instead. I know that monkeypox has been a huge, I've gone into meetings to talk about COVID and monkeypox, and people want me to sort of swap it around. So I'm just checking in with folks to see where you're at. So if you want me to start with COVID and do our normal routine, please give me a thumbs up or say yes in the chat, because I want to make sure you're getting what you want. I see one thumbs up. I see a yes. All right. Okay, cool. And then do me a favor and also let me know, are folks interested in monkeypox again today? So we're going to start that all over, thumbs up and a yes in the chat or a no in the chat, or a thumbs down or some other image. Okay. I saw a few, so we're going to go with it. All right. So here's our King County update. And again, I bring this so you can see I am doing this much of a snapshot, but folks, you can go into our website any day and you can look at our dashboard and it will tell you many other things that I'm not sharing today. Like you can figure out the trends among young people, the breakdown of COVID and hospitalization and death by race and ethnicity, the social, economic, social, and overall health impact dashboard. So just know there's many other dashboards besides the ones that I'm going to discuss today. All right, so we are still at a medium. Again, this is confusing because sometimes, and I didn't check today, the CDC, but I know they've had us, I think they still have us at high. The reason that we are at a medium is that our we have a case count over case count, meaning over 200 cases of COVID per 100,000. Due to home tests, we're not necessarily sure exactly how many we have, but we also count our hospitalization rates differently. So we look at our hospitalization rates as people being hospitalized for COVID specifically, and the CDC looks at our hospital rates for anybody who is in the hospital for whatever reason, but not necessarily there for COVID. So if it's confusing, it's confusing. And we obviously are not on the same page, so that gets confusing. But this is why we are considered medium here in King County by public health. Questions? Okay. Again, our knowing how many cases we have is impossible at this point because of all the home tests that folks are doing. The Department of Health said to even just stop reporting the home test. My guess is people weren't really reporting. So from the cases that we know, we have a 695 daily average case. Oh, Sealy is back, and so Sealy said that they can monitor the chat box, by the way. So Nazik, thank you so much for everything. Super appreciate it.
You are very welcome.
So I'm sure you can think about the people in your life and how many people you know who've had COVID in the past 7 days, and realize that this number is low. But according to our PCR reported tests, we have a 16% decrease in the week-to-week trend. Our case rates are decreasing. They're nearly the same across all age groups, with the exception of 5 to 17-year-olds being the lowest. And again, I'm just acknowledging that testing behaviors may bias that trend and all of these trends. And so we also are, as I've been saying for the last few calls, we are very behind in our sequencing data, which means figuring out which variant or subvariants are going around. But based on our most recent data and also what's going on in the US, but based on most recent data, BA.5 is the dominant subvariant. So BA.5 is a subvariant of Omicron. And just a reminder, BA.5 is extremely contagious and can bypass immunity that people have from previous infections, COVID infections, and from boosters and vaccines. It does not mean the vaccines and boosters are not useful. They are super useful to keep you from getting severely sick, hospitalized, or dying from COVID. But what it does mean is that BA.5 is circulating a lot in King County and the Pacific Northwest and the US in general. Questions for me about BA.5 or about that? No dumb questions, promise. When I'm not doing COVID, I'm a sex educator, so I've heard it all. Questions?
Yeah, I wanted to clarify this 695 daily average, is that for Washington State?
No, nope, just King County.
Just King County, wow,
Yeah,
okay.
so all the numbers I'm giving are just King County, except when I monkeypox, I'll give the US. But thank you for clarifying it. Sorry, and
There's a comment in the chat box.
I suspect that the self-reporting of positive infections is due to the population not knowing who to report to. The self-reporting shortfall, I think it's due to a lot of things. That's probably one of them, especially with huge language barriers. Also, you have to do it. Also, people don't know they're supposed to do it. And Department of Health actually said, stop here in Washington. So I think the shortfalls were due to a lot of reasons. Absolutely, thank you. All right, in terms of hospitalization, we've had a decrease in the hospitalization rates in the last 7 days, but what I noted was the last presentation I did, the hospitalization rate has increased. So, so they've been decreasing over the past week, but they're higher than they were 2 weeks ago. So we have a 19 daily average hospitalization rate. And again, we count hospitalizations for specifically COVID or illnesses due to COVID. The majority of those hospitalizations are folks 65 and older. The huge concern to me about that is in the beginning of the pandemic, before we had vaccines, the people that we were seeing being hospitalized and dying at a higher rate in terms of age were 65 and older. Emergency department visits and admissions for COVID-like illnesses are also decreasing, and our bed occupation remains stable for hospitals and hospitalizations. Again, a reminder that being vaccinated and boosted, people will still get COVID, but it does reduce the hospitalization rates, severe illness, and then also death. So I'm going to make the extrapolation that we know that not nearly enough folks are up to date on their vaccines, up to date on their boosters, but they still have some immunity from the vaccines. So I'm going to make the extrapolation that this is where, even though we're seeing a lot of COVID, folks are not being hospitalized, getting severe COVID, and dying because we have a really high vaccination rate, but not a very high being up to date on our boosters rate. So 2 average deaths a day from COVID-related illnesses. That's been stable over the past 2 weeks. And again, the majority of deaths have been in adults 75 and older, which is why I made the comment that I was concerned about that hospitalization rate. All right, questions about any of that? Okay, so this just shows us the number of folks who are vaccinated and the number of folks who are up to date. So for the total population, all ages, we're about 90% vaccinated. For people who are actually eligible, so 5 and older, 94.5% have started their series. I'm sorry, we're 82% have completed their series of all ages, and 86% of 5 and older have completed their series. So again, I'm going to say that is probably why, even though we're seeing high rates of COVID, we're seeing lower rates of hospitalization and deaths. The concerning piece is when you look at the up-to-date with the boosters, it's gone down since our last call. And we did not have like a population boost all of a sudden. So of people who are eligible to be boosted, only about 44% are up to date. Sorry. Do you know when there's a question in the chat. Do you know when second boosters will be available for adults age 49 and younger? So I think I had this hidden. Let me pull it up. Currently, the second boosters are available for folks who are under 50 and they are moderately or severely immunocompromised, or if you're 18 and older and got Johnson & Johnson for your initial first dose. And I do also believe for healthcare providers, although that is not on our site, but I believe it's also true for healthcare providers. I do not know when the second dose will be, dose will be available for folks outside of that group. So I know that's not a very satisfactory answer, but the one thing I will say is if folks are immune compromised, meaning you have a weakened immune system from either a medical condition or medication, the CDC says, Center for Disease Control says moderately or severely compromised immune system or weakened immune system, and but all of the everything they list in their site is specifically very severe. So, you know, if you are moderately or severely, if you have a moderately immunocompromised immune system, that could put you at risk for hospitalization and death from COVID. So I just would remind people that they do say moderately, and yet their website only has severe. So, and then there's another question. Do you know if there are any resources still for getting free tests for community serving organizations? Celie, I know we have a link. Oh, did you just put the link in the chat?
No, that one was for the boosters, but I'm looking for the one that you're talking about now.
Okay, thank you. So, Debbie, there is, and we'll put it in the chat. Also, if people have health insurance, you can go to the pharmacy and get free. You can get free home tests with your. I'm sorry, y'all. I had COVID 4 weeks ago, and or 5 weeks ago or something, and I still can't get words. So, welcome to the fun world of actually having COVID, which I'm sure many of you know that world. Celia is going to put the link in the chat for getting free tests, and then folks can also get them through their insurance at pharmacies, although some pharmacies don't want to deal with it. I have found, and also you can still get them through the mail, but they're much more limited than community organizations usually need. So Celia just put the link in the chat. Thank you. So the big thing I want to point out here is for this 44% of people being up to date. That is definitely concerning because what we know is that BA.5 and the Omicron subvariants are extremely contagious. BA.5 can bypass previous immunity, and if you're not up to date with the vaccines and boosters, they may have started to wear off, or wane is the official term. So people are so tired of COVID and tired of getting vaccinated and boosted, but the important thing about being up to date is it will help prevent you from getting severe illness, death, hospitalized, and long COVID. So that is why we highly recommend them for folks who get vaccinated. All right, and then so we see complete primary series coverage. Wondering if we can skip this, but 5 to 11-year-olds remains at 53%, with it's kind of plateaued. In all age groups, at least 17 years or older, at least 77% of the community has completed their primary series or their first series. And basically, getting your primary series has plateaued across race and ethnicities as well. The region with the lowest number of folks who have completed their series remains to be in South King County. And then you can see Seattle is 82%, North King County is 86%, and East King County 87%. But this is definitely one of the reasons why Public Health South King County did a lot of focus on South King County to make sure that they had access to the vaccines as well. So, sorry, I'm just worried about time. So I'm trying to figure out what to skip and what not to skip. Yeah, I think I'm just going to skip these and just say, you know, the biggest thing is that we are, that as you've seen, people are not getting boosted when they're eligible at a pretty high rate. People were more likely to get their first booster and then have been less likely to get the second booster. And there is an idea going around about super immunity, that if you had COVID and you had the vaccine or booster, you're now super immune. any studies that looked at someone's immunity and if they've had both COVID and the vaccine that showed higher rates of immunity were before Omicron. So Omicron has changed the game a lot. And like I said, BA5 and BA4 can actually bypass the immunity. So that's where it becomes really important to continue to stay up to date with the vaccines. We know people will get COVID, but they'll be much less likely to be hospitalized or die or have long COVID. And so here are some examples of where we're currently at with that for folks who are not fully vaccinated, are 1.9 times more likely to get COVID than folks who are up to date and boosted. So the vaccine still can prevent people from getting COVID, but they work better to prevent hospitalization, death, severe illness. So folks who are not fully vaccinated are 9 times more likely to be hospitalized and 10 times more likely to die from a COVID-related illness. And then, Celia, that there's something in the chat for you. And Debbie, if we can't find it today, we'll go ahead and send it out when we send out the email. All right, any questions? All right, so some of the top questions we're currently getting at Public Health, I thought we might want to share. One of them is, should I wait to get a booster? When is the best time? And our response would be not to delay. If someone, sometimes people are like, well, there's supposed to be this Omicron one coming out in the fall, so should I just wait and get that? And if you are choosing to get vaccinated and boosted, you don't want to delay getting it because, again, you could get COVID while you're waiting, which means you could get more, but you know, if your vaccine has already waned, you could get really sick. You can also pass it to other people. We know people who are boosted and up to date with their vaccines are less likely to pass it and less likely to have severe illness. And then they're still weighing whether or not to offer the booster in the fall. And one of the things that is we're always going to be catching up with new variants. And so they're still weighing about it. And if an Omicron booster comes out in the fall that includes all the subvariants, it will still be offered to people who are boosted now. So you would still be able to get it. So if you're waiting to get boosted because you think you won't be able to get that one, you will. Any questions about that? All right. Another question is, why should I get my booster? If I'm going to get COVID, if I might get COVID anyway, and also everyone I know is vaccinated and boosted and has gotten COVID. They're kind of two in the same. So I've already talked about this, probably ad nauseum. Aaron, did you have a question? Oh, no. Okay. But really, again, when people have gotten their, let's say you got your primary series a year ago, that vaccine is probably waning and may not be as effective, and it will not be as effective today. So the booster is going to enhance or restore the protection against COVID-19. And again, if someone gets COVID, when they're up to date with their vaccines and boosters, they'll usually get a mild case of COVID. And also, boosters make people less contagious. So you'd be less likely to pass COVID when you are boosted, which is a huge advantage. And then my talking point is that, again, the boosters the vaccines when they first came out were better at preventing people from getting COVID. Now they still can prevent people from getting COVID, but what they're really good at is protecting people from getting seriously sick, hospitalized, dying from COVID, and getting long COVID. If I had any key messages to share with any folks in community, those would be it around why would we want to get vaccinated or boosted. So when people ask you that, these are our key concepts around that, because they're super. I think it's really confusing. We say they're effective, and then people see people who are vaccinated and boosted getting COVID, but they think they don't work. And they do work, but this is what they're really good at. Questions? Okay. Another question we've been getting a lot of is, why am I getting a negative test when I have symptoms? So there's two possible reasons for this. The first, and this isn't something I think is talked about often, so I'm glad we've been getting this question. So one of the reasons could be that your immune system is trying to fight the virus. And so when your immune system is trying to fight it, it is limiting or lowering, at least in the beginning, the virus level in your body. So the COVID test can't detect it yet. But your immune system can continue to fight off the virus, which is why it becomes positive later. So that's why we recommend repeating the test 4 to 5 days after your symptoms start. If you were negative in the first one, I actually did 6 tests before it was positive. My partner had it. I knew there was no way I didn't have it. We go nowhere. We do nothing. We literally know they got it at the pharmacy waiting in line because nobody else was wearing a mask with them. And that's not to blame other people who get it for other reasons. I just wish I could have gotten it from a nice dinner on a patio somewhere instead. So I actually, because I assumed I had it, I actually took 6 tests. One was a PCR, and the 6th test is the one that came back positive. And then we could stop isolating from each other. And then many brands of tests come with 2 tests, but for this purpose. All the brands that I've had have 2 in them. The other reason why it may not be coming, or it may be coming up negative, is that you may not be collecting enough of the sample, enough of the nasal drainage, which I'm going to call snot, when you did the swab. So I know, like, one of the ones that I use, it says do 5 big circles, but it should be at least 15 seconds. And I'm like, it doesn't take me 15 seconds to do 5 big circles. So I just count to 15. So you want to make sure that you have enough of the sample. Questions about that? But again, you also have to have enough virus for it to show up. And home tests are less sensitive than the tests that you get out, the PCR tests, the ones that you go and get tested. So you have to have even more virus because they're less sensitive. So definitely want to repeat. The other thing is, if you're having symptoms, you may want to assume you have COVID, or at the very least wear a mask so you don't pass it to other folks. I'm going to keep going unless people interrupt me. Another question we get a lot of is, what do I do if I continue to test positive with a home test after my 10-day isolation period? And we actually don't recommend testing after 10 days because some people do continue to show up positive even for months after they're not contagious anymore. So, so it's not something that we recommend doing. But if you do it and it's positive, again, the safest approach would be to continue to isolate until it's negative, but also repeat it again. And, you know, I might repeat mine in a day, but at least in 2 days, just to rule it out. Because again, people can continue to show up positive even when they're not. And then if you're unable to keep isolating, just make sure you're wearing a good high quality mask, and avoid spending like time together with people inside to avoid passing it to them. And then again, if you have concerns about the positive test, contact your healthcare provider. You may also want to get a PCR test, which again, they're more sensitive. But again, it's not something we advise, mainly because it might continue to show up positive for a while. All right, and then what do I do if my home test is expired? This has been a big issue because a lot of the tests that big boxes of tests that community agencies are getting and we're getting say that they are expired. So there is a website, and again, these are going to be live links, but many of the brands have had their tests extended, their expiration date extended. So the FDA now has websites that folks can go to see what the new expiration date is. What the new expiration date is. And I want to be really clear too, the expiration date is on the outside of the box. And the only reason I say that is that when you open the box, there's numbers on the inside that look like dates, but they're actually numbers that are like which lab they came from and things like that. So it's confusing. So you really want to look at that, only the expiration date on the outside of the box. Questions at all about that? And then one thing to say is, I'm going to actually go back to that picture. So the picture has a C and a T. The C is the control. So if that doesn't show up, that means that test is no good. So that top line should, I don't want to stop sharing. I want to do this. This line, if that doesn't show up, then that test was not a good test, and you would want to do another test. All right, now how do I undo that?
Becky, can you repeat that again, please?
Yeah, I'm sorry. Who asked me that?
Jackie, the interpreter. I want to make sure I interpreted clearly.
Oh, I'm sorry. Yeah, I'm too busy trying to figure out how to stop drawing. Okay, yes. So if someone does a home test, there is a C and a T on the test. The bottom one, the T, is what shows if they have COVID or not. The top one is like a control group. So the top one tells us that test is working. So that if that does not show up, that test is not good. And so you want to throw it out and do a new test. And my guess would be to do a new test from a new box, but you know, maybe one would work and one wouldn't. So did that make sense, Jackie?
Yes, thank you.
Did anyone else have questions about that? Okay. There we go. All right. So another question. Oh man. Sorry. I have to clear my annotations here. Okay. So we also get questions, how do I get treatment for COVID? So again, if you are at high risk for being hospitalized for COVID, getting tested early and is really important because there are two options for antiviral drugs. So oral medication or pills that will prevent COVID from sticking to your cells or from creating those spikes on the cells. And those antiviral medications will prevent COVID from attaching and replicating in your body. And you would need to take them within 5 days of getting symptoms. The treatment is free regardless of insurance or immigration status, and I'm going to show you in a second how to get them. Well, I'll show you right now. So the 3 ways to get them are to talk to your healthcare provider. If you do not have a healthcare provider or one can't see you within the next 2 days, you can call Washington Department of Health at 1-800-525-0127. And again, I'm spelling all this out so that the interpreters will interpret it, since they interpret what I say, not the slides. So just so folks know. Or you can go to doh.wa.gov/COVID-19 telehealth, all one word, to schedule a free telehealth appointment. If you've already been tested or you've done the home test, you can actually bring the test with you for your appointment. Or you can visit a test to treat clinic and receive testing and treatment there all in one visit. So to find a clinic, enter your zip code in the test to treat locator, which I did not put on here, but you can Google test to treat, or you can call 1-800-232-0233, and you can get support in 150 languages. For TTY, the number is 888-720-7489. A big question I get about the antivirals is, should I take them? And I'm not I'm a health educator, but I'm not a doctor. So I would definitely talk to your healthcare provider about that. But really, if somebody is at risk for being hospitalized for COVID or has underlying health conditions, is immunocompromised, they definitely want to talk to their healthcare provider about getting these. There are some medications people have to go off of if they take them. And with Paxlovid, which is one of them, it sometimes can have like a rebound or boomerang effect, where it's a 5-day regimen of the drug, or 5 days of taking these pills, and sometimes a week or 2 later, some people will end up getting COVID anyway. For many people, taking this medication really prevents them from getting very sick. My parents just had COVID, and they were both immunocompromised and over 75, and they felt really bad the first day, and then they started that medication and they felt much better. So this is not a plug for it. I'm just saying that that I wish I had taken it when I got COVID. All right, any questions about our top questions, or do you have another question that you would like to share or ask? Y'all are quiet today. I said that last time too. We've also reduced how many folks are on the call, so maybe that's why it became quiet. So we have new materials on our website that I think are really critical for folks to know about. One is that we have a toolkit for organizations, and it's resources to help families with questions about COVID-19 and the vaccines for babies and children 6 months to 5 years. The toolkit includes videos, flyers, social media graphics, and many other resources, and they're really lovely. Currently, they're available in the languages you see here: English, Chinese Simplified, Chinese Traditional, Somali, Spanish, and Vietnamese. I'm assuming we will be adding languages to that as well. So this is definitely a request that we've gotten from community agencies, so and from childcare providers. So you can just print these off online, or you can also email them to families. We also have added new videos, and this is just some of them, but from local health providers and pediatricians, including Dr. Ben Danielson and many other providers, answering questions from parents in English, Spanish, and Somali. And so again, there's a lot of the videos, and this is just like half the page. So again, these are lovely resources that you can share with community, and especially, you know, a lot of folks are not able to read, and so the videos are really great because you can watch the videos. Also, they're usually a lot shorter and to the point than I am. All right, any questions about these resources? All right. And then we have two other materials I'm going to show you. We have just like a handout that you can either email or print out for folks so that they can find information in the languages that are listed here through the QR code. So QR codes made a huge comeback during COVID. This is a great resource for communities because it has COVID materials in all of these different languages. And then we have another one that's specific around the COVID vaccine for children and teens. So these are great resources to share with your communities. And for folks who don't know how to use the QR codes, you may have to show them how to use it. All right, so that is all I have around COVID today, and then we are moving into monkeypox. So I need to check my time. Does anybody have any additional questions about COVID? Okay, the one thing I will say is I know everybody's sick of it. And I'm so glad you all are here and still sharing information in community because these new subvariants are extremely contagious. And so I can't even count the number of people I know who've had COVID in the last month. All right, so we've talked about monkeypox. Do me a favor and let me know, do you want me to go through all of this again or just some newer information? Or I'll just do it if you don't unmute and tell me. Or put it in the chat. All right, here we go. Oh wait, I don't know. So we'll do a little overview. How does monkeypox pass from person to person? Symptoms of monkeypox. How do I lower my risk of getting monkeypox? What to do if you think you have it? Apparently we're going to, what to do if you do have it. Sorry, I was like, did I just say that twice? And vaccine distribution. I've been getting a lot of questions and doing this presentation a lot. So I have updated this to try to make it a little bit more clear for folks. So hopefully it will be. So currently we are at 139 cases as of today in King County. The majority of the cases in King County are in Seattle, but that's not all of them, but the majority are in Seattle. And then in the US, we have 6,326 cases of monkeypox. So you can get, again, these are all going to be live links when I send this out, so you can check. And we're always updating, and so is the CDC. 139 cases is definitely more than it was 2 weeks ago. I think we had like 90 2 weeks ago. So the number is definitely increasing. And that said, compared to other cities, our rates are actually pretty low, especially compared to like New York and San Francisco. So what is monkeypox? It's a contagious virus or disease, I'm going to say virus, spread through close physical contact. And the close physical contact has to be prolonged. It has to happen for a little while. People who get sick usually do not need to visit a hospital, and they usually recover in 2 to 4 weeks. So while the overall risk of infection in King County is low, our rates are increasing. So we want folks to know about it, and we want folks, like anyone who's been in close contact with someone with monkeypox is at risk. And again, walking by somebody in the grocery store is not close contact. So really what we're talking about with close contact is skin to skin contact, specifically with sores and rashes, and also contact with prolonged contact with sheets and towels that the other person has been using. And one person always has to have monkeypox to give it to somebody else. That may sound basic, but it's a question I get about STDs all the time as a sexual health educator. So I just want to make sure to be clear, one person has to have it to give it to someone else. And we're going to talk about what the symptoms are, but if you do develop symptoms, you do want to get tested and talk to a medical provider immediately. And in the meantime, you want to avoid physical contact, intimate contact, sex, kissing with other folks, because kissing is another way that'll pass it. One other thing I want to say that I probably have in here later is I say that people usually recover in 2 to 4 weeks. The virus that we have here in the US, super low risk of hospitalization and super low risk of death. So it is something that people get. The problem is they can pass it and it can be painful. They can get scars from it, but we do not usually see death and we do not usually see hospitalization. As I mentioned, one person always has to have it to give it to someone else, but they can't pass it until they have symptoms. So somebody will be exposed to it and get it in their body, but the symptoms appear. And when I say symptoms, I'm talking about the rash and sores, because sometimes people have like flu-like symptoms, and that's not what they're going to pass them from. They're going to pass them again once the symptoms start showing up and the sores show up. So 1 to 2 weeks after someone is exposed is when they are contagious. We are following up with all the folks that we know who have monkeypox. So doing there is contact tracing happening with monkeypox. COVID definitely made that term popular, but just to say, this is something we have done for years with HIV, with syphilis, with other STDs. So monkeypox is not an STD, but it's something that can be passed through sex and that we want to get a handle on. So we are following up with folks who may have been exposed. And then if somebody knows that they have monkeypox, they want to tell anybody that they may have exposed. So it can be passed from person to person through direct contact with the rashes and sores, which I'm going to show you some pictures of, from touching shared items, and again, prolonged touching of items, meaning for a while, of clothing and sheets and towels that have been used by someone with monkeypox. And we're still figuring out how long. So if someone's going to ask me, how long? We're still figuring all that out. And really, it does often depend on how long that item was exposed and also what the item is. And if it's, you know, like how well the virus can live on that surface. I hate the term face-to-face contact, but that's the term that's used. But really, it's usually going to be some kissing because it can be actually passed from the saliva. So really, like kissing someone for a while. Again, this is one that's like a prolonged thing. So kissing with someone for a while, and no, I don't know exactly how long, because we don't know exactly how long, or from sex So right now, the way we see it spreading is mainly from sex. So here I say sex and intimate skin-to-skin contact. So that could be, again, skin to skin, so naked, cuddling and massaging, but also sex, making out, kissing, all different kinds of sex. And then people who are pregnant can pass the virus through their pregnancy. And that, yes, so which means that the baby could be born with monkeypox. So examples of how people get it: direct contact with the lesions and rashes caused by monkeypox, by someone who has monkeypox, sex or kissing for a long time with somebody who has monkeypox, sharing a bed, sleeping bag, wearing their clothing, doing their laundry. We want to take care of people, but we also don't want to get monkeypox. So we don't want to be handling their sheets, their towels, their unwashed clothing. And again, with somebody who has monkeypox. And then sharing a towel with somebody. So I got the question, can someone get monkeypox in a pool or a lake? So the next slide is going to say no. But the bigger concern is if you're sharing a towel with somebody who is naked skin, because they were just swimming, was exposed to the towel. And so the rashes and lesions may have been exposed to that towel. So they can get it from, again, that towel at a lake or a pool with someone, from somebody who has monkeypox. Am I at 5 o'clock? Okay. Bye, David. And then examples of ways people can't get it. And the reason I've added these is I've heard so much fear in community. So I want to be really clear. You're not going to get it from this isn't airborne. This isn't COVID-19. You're not going to get it from casual conversations with people. You're not going to get it from walking by someone in a store or on the street. You're not going to likely get it from things like doorknobs. You're not going to get it from swimming in a pool or a lake. And again, it's harder to spread than COVID-19 or the flu or other things like that. So this virus is harder to get than COVID-19, flus, colds, because you do have to have that close, intimate skin-to-skin contact with somebody. Questions? All right, trigger warning. Even though there's lots of research that trigger warnings don't work, but here's your warning to close your eyes if you don't want to see pictures. But I'm going to show pictures. So I should have allowed time for the interpreters to tell people that. All right, so I've added more pictures because what was happening was people were just seeing one of the bumps, but not the ones that are next to it. And so it was confusing. So the main symptoms, people can get fevers, exhaustion, headaches, swollen lymph nodes. Those signs usually show up first. When they're contagious is when these rash and sores appear. What we're still learning is most people are going to get rashes and the sores. Not everybody does. So what we're still learning is how are people contagious when they're not getting them. Often the rash and sores will show up anywhere where there's been contact. So since this is easily spread through sex, we are seeing it on, I'm a sexual health educator, so genitals, let's just say, it can show up on penis, on testicles, on vulva, on vagina, on anus or butthole, but also can show up on our hands. We don't want to be like scratching them because we can spread them on our own selves. To be really clear, they can spread from the moment they show up until the skin is healed, the scab is gone, and you have fresh new skin. They can leave a scar, but it's not the scar that we're worried about. It is actually the sore. The sore, even if it's scabbed over. By the way, this is true for cold sores and herpes too. And it has to be fresh, healed skin before it is not contagious any longer. So anyone can get monkeypox through the behaviors that we already talked about. Currently, the folks who are having the most recent cases of monkeypox that we're seeing are among men, and specifically men who've had sexual or close physical intimate contact with other men. But I want to make it really clear that people of all genders and all sexual orientations can get monkeypox. And whether or not someone gets monkeypox is based on the behaviors that they are doing. And if the people who they are doing them with, i.e. having sex, physical, intimate contact, any kind of sex, if that person has monkeypox. Questions? Two things I want to make sure to spell out. One is I'm going to just be very transparent. I did not use any pictures until we had a variety of color of bodies with monkeypox. Originally, when I Googled, it was all Black folks, and that can create lots of racist stigma. So if you're someone doing education and community, you really want to avoid that and show a variety of people. The other thing you notice here is that you also want to avoid stigmatizing gay men. That really anybody can get monkeypox based on their behaviors. And so I'm just being super transparent in terms of like, how do we have these conversations with people is we do not want to do what happened during the HIV, the beginnings of HIV, because those myths don't go away. I've said I'm a sexual health educator many times. I've been doing it for, before monkeypox for 20 some years. And to date, I still get questions like, is an HIV a gay disease? So again, currently all the cases are in men, but anybody can get them, and we want to avoid stigmatizing people. Questions about that? All right, so how do I lower my risk? What time are we at? Okay. Limit close contact with people with monkeypox or think that they have monkeypox. It's probably a given. Clean and disinfect areas and items that someone with monkeypox would use. Again, if you're going to be, you'd want to be wearing gloves to make sure that you're not coming into contact with the virus. And again, even if they just if they were scabbed over, I didn't explain this, but what happens is the virus can actually, like the term is shed, but the virus actually comes through and sheds through the sores, whether or not they're scabbed. So they can be on the clothing, the sheets, and the towels. You just want to keep yourself updated about monkeypox, and especially if you're traveling and thinking about our like behaviors and having open conversations with people, people who are sexual partners, people who are physical partners, like you hug a lot, you cuddle a lot with, having open conversations. Again, these sores are painful. So unlike other things like syphilis, syphilis is a painless sore. People don't often know that they have it. These ones are painful. Wash hands often with soap and water. Use alcohol-based hand sanitizer, especially at before touching your face, before eating, after going to the bathroom, and then avoid gatherings of skin-to-skin contact. So things like raves or like parties that are going to have lots of close skin-to-skin contact, because again, that could be some prolonged contact with a sore. And And then in terms of lowering risk through sex, limiting number of sexual partners, and using condoms. Again, condoms only protect what they cover. So if the store is not under the condom, it's not going to protect the other person from getting it. So using condoms can be helpful, but they protect what they cover. I already mentioned having open conversations. And then if you have symptoms, you want to get tested and get medical care right away. And so, again, if people don't have a medical provider, they can call 1-800-756-5437. And currently, we are also recommending the Sexual Health Clinic at Harborview, which is on the 11th floor of Harborview, which is at 908 Jefferson. We will be recommending more places as we're working with many community partners to set up both testing and vaccines. And then when you go to get tested, if you go to get tested, you want to be respectful for the provider. So you want to cover the area, and then you're leaving your house. So you want to be respectful of other people. So you want to make sure that the area with the rash is covered with clothing. You want to wear a mask. And then again, you want to avoid having sex with other folks, or again, that close physical intimate contact, and make sure to wash your hands often. I already gave this information about Harborview, but I put it in here a few times, and the phone number to call. And then again, if you have monkeypox, it's really important to tell people you've had sex with, to tell people who you just gave a massage to tell your hairdresser who was just touching you for 40 minutes. So, this is all close contact and touch. People you were kissing, and let them know that they need to get tested right away. Do not touch your own sores and rashes, because you can actually spread them to other parts of the body. And that can make your healing process longer, also much more uncomfortable. So you do want to avoid touching the rashes and sores, or please don't pick the scabs. Sorry if I just grossed somebody out. You want to avoid going to spaces where there's going to be a lot of close contact, and you want to stop having sex and physical, contact and kissing and all of that until you get tested. Sorry, that's supposed to say until the monkeypox symptoms totally go away and you have fresh skin that is healed. And then also you want to disinfect surfaces, wash your clothes often. If possible, I want to recognize that not everybody has access to washers, not everyone has access to a home, right? Get the vaccine. The vaccine can actually, if you get it within 4 days, it can actually work to prevent somebody from getting symptoms or getting monkeypox. And if you get it within about 2 weeks, it can actually reduce your symptoms or make them not be as bad. So this is a time where the vaccine can actually work before and after, but it is very specific. You have to get it pretty quickly after getting monkeypox. And then avoid contact with your pets and other animals, because you can actually pass it to pets, which none of us want to do. All right, and then again, a reminder that even though this virus is spreading, we still have a pretty low number. We know how to prevent it. We do have a vaccine, even though we don't have a lot of it. And when people know they have it, they really want to avoid passing it and make sure to cover either isolate or cover their rash and wear masks. And then again, most people are going to, over 99% of people who get this form of the disease, the form that we have here in the US, survive the illness and heal after about 2 to 4 weeks. People who are at risk for more, like for serious illness and possibly death would be people with weakened immune systems or immune compromised, children under 8 years of age, people with a history of eczema, and then people who are pregnant or breastfeeding, because again, their immune systems are taxed from the pregnancy and the breastfeeding, or their immune systems are weakened, sorry, from the pregnancy or breastfeeding, or chest feeding. Sorry, I did not write that in there. So people are breastfeeding or chest feeding. And then again, it's rarely fatal, rarely deadly, but the symptoms can be extremely painful and they can leave scars. All right, and then the folks, currently we have a really low, the vaccine's already been created, so that's great, but we don't have a lot of it here in King County. So really, the vaccine supply right now is being used for folks who are either have been in contact with folks who have monkeypox, and again, that close contact, and have been exposed. So if you think you've been exposed, you definitely would want to contact the phone number I have had on here a number of times, your provider, or Harborview. And like I said, if given between 4 and 14 days after the exposure, the vaccine can reduce the symptoms of the disease, which again, since it can be highly painful, that's great. We will be getting more supply of the vaccine, and we are working with our community partners to distribute the vaccine, not just in Seattle, but in other community healthcare partners, but to make sure that we can also distribute it outside of King County as well, like we've done with COVID. But right now we just have a very limited supply. And then I am going to send this out. And again, it has live resources, live links, so you can look up more information. And then as more providers are serving our community, we will have more providers listed, both in these conversations and in on our website as well. All right, I think we're at 5 o'clock. Oh, we're after 5 o'clock. We're at 5:05. Does anybody have questions for me, or comments, or thoughts, or? Okay, I'm going to put my email in the chat, because again, if you have a group of folks who need education about COVID or monkeypox in English or any other language, we have a lot of folks who can provide the education in language, so in like Spanish, Oromo, Amharic, Arabic, I'm forgetting some, Lingala, French. We also can always provide interpreters as well. No questions? Did I do just that great of a job of answering them all? All right, and then with the folks who are still on, we are going to send this out, but I do want to remind folks that sorry, I'm like, did I miss it? No, okay, sorry. The third part of our vaccine series that we are doing with Best Stars for Kids is going to be on routine childhood vaccinations, and my lovely colleague Deborah Berliner is leading that, and she's amazing, and I'll be going to that. And then we also have a 3-part series coming up in Spanish on all about COVID and the vaccines, how to talk to folks who are not vaccinated in respectful ways, using evidence-based evidence-based behavior change research. And then the third part is going to be on routine vaccinations for children. So just wanted to make sure that folks knew that this was happening, and please share it with your community partners who provide education in Spanish or provide information in Spanish. And then I also wanted to remind folks about I know we have Spanish interpretation on this call. It's not nearly as good as going to a call in Spanish. So I highly encourage folks to attend these calls if you speak Spanish, because Gina and Giselle, who present them, are phenomenal. All right. And Juan just gave a shout out for it as well. All right, so as always, we will send this out. It may take a few extra days to send out, because as you notice, my lovely Vanna White, i.e. Justin, is out of the office this week. So, I need to figure out how to stop recording. So, does anybody have any last questions for you while I figure that out? Does anyone know how to end recording? Oh, there we go.